Good morning, everyone. I am Jessie Whittish with Kentucky Youth Advocates. It's great to see all of you this morning as we're going to hear from cabinet secretaries, DCBS commissioners, and deputy commissioners. This is a big one today, everybody. So just a quick housekeeping reminder, we are going to record today's forum as both a podcast and a video. So we ask that you stay muted, but drop your questions in the chat. I know Commissioner Miranda-Straub has already said she's open to fielding some questions. So please drop those into the chat as you have them, and we will get to those as we can. So with that, I am going to turn it over to Dr. Terry Brooks.
Hey, thanks, Jessie. I think we always say welcome, welcome, welcome. This is like our 108th consecutive Wednesday deal, so we're in it for the long haul, and I know some of you are darn close to having those perfect attendance pins, and some of you are brand new, and we're just really happy to have everybody here. As Jessie said, today and next Wednesday is part of what we believe is a really significant two-part series. You know, I need to share with you that I began talking and listening to people around the importance of workforce as it relates to CHFS and DCBS probably a decade and a half ago. What is so positive right now is that CHF leadership with Secretary Friedlander, DCBS leadership with Marta, they have combined head and heart on this issue. It is easy, in my opinion, for those of us who care about kids to focus on transitioning out of care, or parameters around childcare, or issues around public health. And it's absolutely appropriate that we do that. And yet I sometimes wonder if there is not a predicate, which is that if we do not have a high quality workforce, if we do not have a 21st century workforce that fits 21st century challenges, then I'm not sure if we can pull off the very best of policy and practice ideas. As certainly my KYA colleagues know, I'm not interested in college football. I'm obsessed by it. And one of the conclusions I've had is that it really helps to be a great coach if you have a great quarterback and tough linebackers and quick cornerbacks. And my hunch is that the best visions that the governor, that legislative leaders, that the secretary, that the commissioner, the visions that pull people together in a common ground are inspirational, but we gotta have the workforce to pull that off. So I want you to hear really clearly that today and next Wednesday is way more than rhetoric. It's about the realities of how we deliver for kids. And I cannot imagine a person who is better positioned to be a catalyst for that and to articulate that vision than Secretary Friedlander. I've been very upfront because Eric is one of our most regular appearances here. Eric is a leader I admire, and he's a friend that I value. So I just need to be transparent about my respect and affection for the secretary. The flow of the day is going to go from the secretary to the commissioner. Deputy Commissioner Dennis is going to weigh in. And then we're going to spend the last 20 to 25 minutes in a little bit of a dialogue that I'm going to have with Marta and Lesa. But we want to kick off with words from Eric. That sounds like a segment, words from Eric. So here's words from Eric. Mr. Secretary, thanks for making time for us today.
Thank you, Terry. As always, I appreciate the opportunity to come and address folks. Earlier, there was Eric and Terry show pitch. We may need to work on that, but words from Eric, I like that. So, I appreciate the kind words, and that I return that in all manner of how we have worked together over the years, Terry, over many years. So on to today's subject, 21st century CHFS, 21st century DCBS. I want to just address a few things. First, I think one of the things that may end up propelling us in ways of new ways of thinking, of new ways of doing things, is of course how we responded and how we have responded to COVID. First, I want to tell you I've been vaccinated. I want to demonstrate something. I'm not magnetic. All of those rumors are not true. It doesn't work at all. It doesn't help grow hair. None of that. None of that. Get vaccinated. That is the most important message I can give to you today, and all of your staff and everyone in your care who can. These vaccines are tremendously safe and tremendously effective. So please, that was my demonstration for you. With that, I want to also then talk about what else we've learned, right? Within how we are looking at our workforce, how we are looking at how we do things differently. Many of you have heard us describe our pillars of equity, with a focus on racial equity, with resilience, with that focus on the thread of trauma that goes through so many of the folks we are all serving together, and then how that impacts us, how that impacts folks who are working with folks who are going through trauma, have experienced trauma, how we not let that get on us, and for that to take care of ourselves and really address the secondary trauma that one of the reasons I'm so excited that Commissioner Straub is Miranda-Straub is on board. How we do that, right? How we express and explain what it is that we're doing to support people in our communities, to support how we work with the economic side of it, how we work with the health and wellness side. These are all vital pieces that we're going to pay attention to and keep paying attention to, because again, I hope you all have heard me say this. We are trying to make sure that individuals and communities are able to live up to their full potential, and how we can support doing that. That is what we want to do. To that end, I hope that Connect is out there, our resources, our benefits, our healthcare side of it, but it's more than just a slogan and a website. It really is about how we break down the barriers across the cabinet. We've been working very hard on that. We've been working very hard on making sure that we understand the behavioral health impacts, as well as substance use impacts, as well as impacts on individuals who may have disabilities. These are things that we're trying to make sure that we're connecting across, right? What are our public health goals? What are our Medicaid goals? We have a single MCO provider with the SKY program that was started by the previous administration, but when something is good and it should work, you continue to do that. You continue to build upon those things that work and are effective. So what I'm saying is, we know we have workforce out there. You all know this too, that we've been through a traumatic time as a community, as a state. Those folks who are in the service portion, the service to individuals part of this, it's been a tremendous challenge. It's been a challenge to continue to do the good work and to continue to do self-care and feel like we're in this emergency mode all the time. I've likened it to, about 6 months ago, we felt like, the lobster that had finally climbed out of the pot, and now we're getting ready to jump back in again, or already jumping back in. That's hard. That's very hard. So we have to acknowledge that for each other. And we have to think about how we do things differently. Within DCBS, talking about a 21st century DCBS or 21st century cabinet, that means how do we support as many people as we can through our virtual environments like we're doing now? How do we support people as much as we can in thinking about how we do work differently, right? If you go into any of our offices, Deputy Commissioner Dennis can talk about this. You know, we were frightened that we get inundated in our waiting rooms, right? And in our offices. Just hasn't happened. It just simply hasn't happened because we've tried to support how we do things differently. So we need to continue to do that. I think that's, we heard from all our employees that that's what we needed to do, but that's not enough. And you all know this too. As you experience folks who we end up calling essential workers and reward their essential nature by paying them less, that is a challenge that we have all across the country, all across the state, in your programs and in DCBS. We know that we need to look at that, to work on issues of equity, to work on issues of how we compensate folks to make sure that they have a living wage job where they can pay their bills. You know, we have folks who work for the cabinet who are eligible for our cabinet programs. We need to get away from that. We need to stop doing that. That's a huge commitment and has the potential to be a huge commitment in upcoming budgets, and we'll advocate for that. But the other thing I want you all to take away from this is there's another thing we need to advocate for. I think I'll have an op-ed out here pretty soon, but we're all working hard. We're all working with most vulnerable clients across the state. And yet we hear examples of, you know, in childcare, we've had an individual singled out who has done nothing but try to support the childcare industry. We heard on the Senate floor in the special session, folks calling out Dr. Stack. There is no one who's worked harder than Dr. Stack through this pandemic. We would be lost without him. I promise you that. We are so very fortunate to have him. We've had a group come out, you know, the Stop CPS or whatever their name is. I don't even want to say their name. But going after individual workers, that's just not acceptable. And you need to know, and I know you all know this, the folks who are working for the cabinet are doing the very best they can. And we all need to support each other. The one thing I've said, and I'm still trying to figure out how to make this as resonant as possible, is that if we learn one thing from COVID, just one, it's that whatever happens or impacts one of us in our communities impacts us all. You know, a virus doesn't care about anything. A virus will go from person to person no matter what, right? So if somebody someone who is homeless, well, we saw this with hepatitis A, right? If somebody gets a disease, it spreads out, right? And poverty and inequity and racism and sexism and all those kinds of things, those are societal diseases. We need to work on those together because just like any virus, whatever happens to one of us impacts us all and takes away from our collective full human potential, right? So we need to work together to address that. We need to work together in our workforces. We need to work together for those folks that we serve in common. These are important things for us to know. And it's a challenge, but that's what being a 21st century cabinet's about. That's what being a 21st century DCBS is about. It is that we have to work together on those root causes that will make a difference in the long term. Call them root causes, call them social determinants of health. But those are the things we need to be working on upstream as much as possible. Again, you know that we don't support that. We don't support prevention as much as we should, but we are moving towards that. DCBS is moving towards that. The cabinet's trying to move towards that, particularly in our Medicaid program and our other programs. We're trying to get upstream. Let's get upstream together and make that difference for the folks we're all serving, for us, for the folks we're working with. If we could do that, we will have a better Kentucky. We'll have a 21st century Kentucky, and it can start with us. With that, I would have no one I'd want to be a partner with on this in terms of being a visionary than Commissioner Marta Miranda-Straub. And you will hear her vision, you'll hear her passion. I know you have heard it. Deputy Commissioner Dennis, with her experience and her passion, I hope you have confidence that we are trying to move in the right direction and move towards the future, because that's what we all need to be doing. And with that, I will turn it over to my partner in this, Commissioner Marta Miranda-Straub. Thank you, Marta.
Thank you, Secretary. I am honored to serve with you and with Lesa and with this amazing governor who has the courage to make the bold decisions and speak truth on a regular basis. It may cost him his second term, but he certainly has gained, I think, a lot of respect for doing the right thing, and so have you, Secretary. And I can't imagine living retirement for any better reason than to serve as the commissioner for DCBS. I have learned a lot, and this last year of COVID has really confirmed the commitment of our staff, the performance of our staff, the need for our services, and how crucial what we do is. I am going to say that I will give you our vision, and Lesa is going to talk a little bit about how that vision looks like in operations. But I must tell you that our biggest challenge right now is how do we do the day-to-day of basic services while staff can make so much more money working at a back store or at a restaurant than they can working for DCBS? How do we keep doing this hard work with the loss of capacity that we've had due to retirement and due to, we've always had an issue with turnover. We've always been bleeding. We're hemorrhaging right now. So I'm going to ask you for grace, and I'm going to ask you for compassion for my staff, because they are not okay. And as leaders, it is always important to keep the vision and keep pushing, although we're dealing with so many whack-a-moles every day and so much smaller capacity than we need, and not valuing our workers the way they need to be valued, with the respect of the community for the hard work that they do, as well as for the pay that they do not make, as well as for the trauma that they carry. Do we make mistakes? Have we made mistakes? Do we continue to need your help and hold us accountable? Absolutely. That's not to negate any of that. That's why we're building a new transformation for our agency. However, it is not okay to attack workers and to lie about no checks and balances. One of our staff members has been accused of kidnapping children, as if we don't take children away. The court decides whether that child needs to be taken away or not. So her family has been threatened. We have directors whose reputation is being defamed. So at the time when we're all hurting, usually what happens is we take it out on each other. And my staff is receiving multiple attacks on multiple levels as a result of how much pain people have, how limited we have been in being able to provide, and I take this on us and the leadership, the structure and the support that our staff really needs to do their job. And we're at a crisis moment. And we'll talk more about that in the next forum. But I wanted to follow up on the Secretary and ask you all for your support and your grace and your respect of our staff, who is, the metaphor I use is, I love the ocean And when you get in the ocean, sometimes a wave gets you and runs you around, and you get sand in all the wrong places and you don't know where you stand. And then when you think you're getting your head up, another wave comes and throws you out and you can do less. Well, we're at a third wave here. As much as we need to stay focused on the vision, we realize that what's happening in the day-to-day is really limiting our ability to do what we're mandated to do with grace and with competency, as well as continue to work on a vision that seems unrealistic, given the challenges of today. So that's on us. That I always pledge transparency with you. I'll always let you know where we are and tell you the truth about where we are. So that's where we are. So if you will begin the slides, I will go ahead and walk through those, and all of you would receive these afterwards. I'm honored to be presenting with Deputy Commissioner Dennis, who will be talking about the operational part of this work. Next. So here are the imperatives that I brought to the table when I came in. We must address disparity and disproportionality. We must engage and learn and implement the talent and wisdom of those who have lived experience receiving our services. We have added trusted advisors, and with the facilitation of KYA, this fall we will be making those trusted advisors a council to be able to walk along with staff, hold us accountable, in addition to not just helping us with this strategic plan for this 21st century, but continuing to work along with us as we implement and evaluate. We are not police for the state. We are social servants. We must strengthen the C in DCBS and make that a huge C, because we're not Walmart and we're not a one-stop shop. We need our partners with us in transformational and impactful ways. We must and are in the process of designing comprehensive community wraparound prevention collaboratives to be able to go back to the community and to go able to have the community be key in preventing issues before folks get to our emergency room, which is protection and permanency. And we must move upstream. We must begin offering addiction treatment, support, mentorship, resources way before people are so depleted that they have nothing left by the time they come to our services. Thank you. Next. So the overarching outcome goal is to decrease barriers and increase access. We're a bureaucracy. We started in 1996. A lot of our language is updated. So we're in the process of organizational transformation while we're dealing with a pandemic and while we're dealing with incredible workforce challenges. The outcomes of this will be thriving families, all children, all families, no exceptions, achieving the highest human potential possible for our clients, building a resilient organization and healthy and supportive workforce, and engaged and valued consumers. High impact collaborations, not just signing off on grants together and initiatives, but working hand in hand with each other, and investing in primary and secondary prevention and building a division of primary and secondary division prevention that reports directly to the commissioner. Next. So here is the 5 pillars. You've seen this before. I'm not going to repeat them, but here they are. These are the pillars of our foundational work as we move to building a 21st century DCBS. Next. Here is our basic practice elements based on best practice. Again, I'm not going to read them to you, but here they are so that you have them and you can continue to know what we're basing our growth and our transformation and our evaluation of programs and redesign as we move forward. Thank you. Next. Equity. In the equity pillar, this is where the social and economic justice component of our work comes in. So we're looking in all of our programs around inequities, disparities, and disproportionality. We're looking and educating ourselves and others, doing lots of training with community partners, with our staff, about the high cost of living in poverty, the cost of transportation, of housing, of foods, of education, things that are seen as neglect or seen as, fraud are just a result of poverty. They're not result of intentionally wanting to neglect or committing fraud. I might not have transportation to get my food, or I might have not been able to afford to wash the kids' clothes to send them to school. I might not have been able to get daycare because of the high cost of daycare. Poor people spend about 80% of their people living in poverty. They're not poor. They're the most resilient people I've ever known, both as I grew up in Cuba and as I lived in Appalachia. The most resilient economists and brainstormers that I know. However, it is really hard to live in poverty. The banks don't want to give us loans. So we're prey to those lenders that are loan sharks. And we spend about 80% of our income on food, housing, and utility bills. We have a lack of wages, living wages, skills, and education. And all of that is a systemic way that people live in poverty. The myth that people really like handouts, if we tell you what it will take for you to feed a family with what we're able to offer, without folks sleeping on somebody's couch or having other people help them, they will never be able to survive. Next. Here are the social determinants of health, just to remind us all that your zip code and your geography determines how long you're going to live and what kind of quality of life you have. So this is crucial for us. And this is shaped by cultural attitudes and public policy. Next. Social justice. We're striving to become an anti-racist organization. We have disparities and disproportionality just like everyone else has. Once you know more, you do more. Once you know better, you do better, as Maya Angelou says. And we're learning as a result of this, the largest civil right in our history about the disparities. And we're learned and seen through the veil of lifting of COVID, how fragile a lot of us are. And here we are in the stark reality of where we are as a country, where we are to sustain. We must address the disparity, disproportionality, bias, and assumption on a policy level and at a practice level. We have added content experts, Dr. Trinidad Jackson and Dr. Kelly Brandy Pryor, both experts in public health and in equity and social determinants, to help guide and train our staff. We are creating a core racial equity team as part of CHFS and as part of DCBS. And we have expanded our race, community, child welfare, we have been in some regions to every region. In addition to that, we're working with the courts on a joint vision statement on racial equity, inclusion, and justice. Next. So trauma, resilience, and engaged healing, huge pieces for our staff and huge pieces for our clients. We must address the continuum of trauma, from chronic stress to vicarious trauma, to compassion fatigue, to secondary trauma, to impairment. That's the continuum. That was my research work, my graduate work, and it's been my work for 35 years working with impaired professionals. How can we not, having me at the helm, having the secretary reach out to me to bring that to the cabinet and to DCBS, how can we not do that? How come we haven't done that in a structural way? So we're here to commit to this work. We must address through policy, protocols, and practice, and make sure that seeing the secondary trauma is a result and part of our work. It's not a separate dangling participle that you do on the weekend by getting your nails done or a massage, if you're privileged enough to do that. It's part of the day-to-day work. We must debrief and apply administrative support. We must continue to provide training on resilience building, and we must build capacity. We must build capacity and expertise within our workforce. We've asked the legislator, the governor agreed in our last budget that we needed at least 70 highly expert social workers that knew complex trauma to come in, take the really highly complex trauma cases with small caseloads and be able to support and be the content expert pool for our frontline staff who are younger and don't have that kind of experience. So we need the capacity, and we need to provide pay equity. Nobody's done it because it costs a lot of money, and the pay inequity in our area is huge, and we're committed to doing that. And these are long-term, these are not short-term. The secretary likes to call it my water on the stone, and we will continue to work on that. And we must work towards all employees making a living wage. We don't make a living wage. Many of our staff does not make a living wage. And it takes between $15 and $19 for people to be able to live their life and pay their bills. Next. So at this point, I would like to invite my deputy commissioner, the wind beneath my wings, the most graceful, compassionate partner that I have ever had in really having my back and teaching me so much. So it is a great honor. And I'm so touched by having you here. Talk about vulnerability. We are not all okay. When I cry though, know that I'm okay. I paid really good money for these tears. So for me to be vulnerable and transparent in front of all of you, is a real gift of a hell of a lot of therapy and recovery. So it is with great joy and respect that I bring Lesa to talk about, she's my operational guru, right? To talk about how does all this vision translate into what we're doing. So thank you, Lesa.
Well, thank you, Commissioner. And I can't say what an honor it is to get to work with you every day either. So thank you for everything, and thank you for your leadership. So what does trauma, resiliency, and engaged healing look like? It's the professional development for our staff. Training and skill development doesn't end with the onboarding of a new employee. It should be ongoing, and it should be intentional. It's trauma supports and debriefing groups. We are working to create those within DCBS to allow staff to have an opportunity to talk about their experience following a critical incident and express what they need to be supported. It's ongoing skill-based training to identify and address chronic stress, burnout, compassion with vicarious trauma and secondary trauma. It's building a prevention service array that includes primary, secondary, and tertiary interventions. It's expanding design work and bridges out of poverty formats and training, incorporating those concepts into all aspects of our work within DCBS. It's also about looking at those partnerships we have with others. DCBS is currently working with our sister agency, the Department of Behavioral Health and Developmental Disabilities, and with the University of Kentucky's Center on Trauma in Children with the System of Care 5 grant to address secondary traumatic stress within our child welfare workforce. Currently, 7 of our 9 service regions are participating in that opportunity. We are also working with Dr. Austin Griffiths with Western Kentucky University on a research project looking at biometric data of our staff to determine how stress impacts their health and well-being. And we continue to partner with the Cabinet's Office of Health Data and Analytics to evaluate the implementation of Family First to enhance service provisions and expand evidence-based practices. Next. So all this work continues, and all it leads us to is a new business model, differentiating between poverty and neglect. We know that being poor doesn't mean that a person is neglectful. As the commissioner said earlier, oftentimes, if not most times, it means just the opposite. It means the person is resilient. We are also applying a strength and resilience framework throughout the department, ensuring that our work remains client-centered, human-centered, and approached through a culture of safety. We are working to include frontline staff and individuals with lived experience in all areas of our work, and ensuring they are involved in the planning and the training and the policy and program development and evaluations. We are also assessing and evaluating policy, practice, and programs, and disaggregating our data in that process to identify disparities and disproportionalities in programs with the goal of making systemic and structural change. And we continue to look at our language. As the commissioner stated earlier, DCBS is not the police for the state, and our language should reflect that in designing a new community of practice. So some examples of operationalizing this new business model include, we have launched a statewide prevention collaborative to provide structure for community-based providers, sister agencies, and stakeholders, including those with lived experience, to guide and formalize a cohesive approach for primary and secondary prevention statewide. These efforts will be community-based and family and youth-driven. We are working, we have requested to create a division of prevention. As a result of the implementation of the Family First Prevention Services Act, DCBS has had the opportunity to invest and expand prevention services. And we have continued to seek opportunities to expand both primary and secondary prevention. We believe this new division will help us accommodate the growth in prevention services offered and supported by the department, and will align with the intentional focus on community-based delivery of services to families and move us more upstream to avoid child welfare involvement. We have began our first learning cafe with the support of KYA. We are focusing on the book Upstream, and this is a new and innovative way of bringing training to our staff on such a foundational topic as prevention. So we're very excited to have that initiative underway. And again, having important conversations, helping staff to think about prevention and looking at issues earlier and how to intervene, again, more upstream. We've also implemented the Qualified Residential Treatment Program in early 2021 to ensure that youth who do need to be placed in a congregate care setting are placed there because of treatment needs only, and they are there for trauma, and their care is trauma informed and is time limited. We have seen the reduction in the use of residential settings by a little over 24% in the past 2 years. This means that children are remaining in family-based and community-based settings where they experience more normalcy, which we're very excited about. Then we're also looking at how to modernize KTAP. The KTAP program eligibility has remained relatively unchanged for the last 25 years. We want to see where we have flexibilities and make changes that either improve access to the program, improve the program's outcome, or improve workflow efficiencies. And with regards to our workforce, we have been successful in getting an improved telecommuting plan from the personnel cabinet, which means our staff will be able to continue to telecommute or work a hybrid model beyond the pandemic. And also one last thing with regards to workforce that we'll mention here today is that we're working with EKU to enhance our training for new employees. We've often heard from our new employees that our training did not adequately prepare them for the job. So we are working with EKU to move away from the current academic training model and creating a DCBS certification program that will be skill-based. And these are a few examples of how we have been operationalizing this new business model and moving us more upstream towards a 21st century agency.
Okay, great. Thank you. Thank you so much, both Marta and Lesa. What we want to do is take the last few minutes and have a little bit of a dialogue with Lesa and the commissioner. And then next week, just as a preview, we're going to have some key partners on the call. Their homework assignment will have been to listen to today's forum if they're not on it live. And then DCBS leadership and these partners are going to have a dialogue. So next week will be highly informal and very interactive. But as I sat and listened, a couple questions came to my mind. One of them is that Marta, I know that in your previous life, both as an academic and a nonprofit leader. And Lesa, I know you have rich experience within DCBS itself. So my guess is both of you had certain perceptions about DCBS in your work. I know that you recently conducted a really thoughtful, reflective, strategic planning process. And I'm curious that at the end of that strategic planning process, what was, maybe not, I'm not asking you to prioritize, but what was a surprise that came out of that? You entered it, and if we're honest, you both thought you kind of knew what the scene was, either, you know, because of your experience and perception. But my guess is, knowing how y'all think, something out of that came and you were like, well, man, I didn't see that coming. So what came out of the strategic planning process that you had no idea going in? Commissioner, you want to open, and then Deputy Commissioner can do part B on that?
Yes, I consider myself an organizational midwife. Birthing something is not funny, it's messy. We all want to get off the table. We're challenged by it. And my job is to keep saying, I know this is hard, but we need to keep breathing. And we need to keep walking towards that goal, that end. So for me, is how many people were willing to be visionary in the midst of how challenged they were. My biggest surprise as DCBS commissioner is the amount of competency, passion, and commitment that the staff have. I, like many of you, thought people were sitting around making barriers so they didn't have to serve people. And that still may be true in some areas. But what I saw as part of this practice, both from my staff and from the clients and the partners, that the clients and the partners, instead of complaining about DCBS, were so engaged and so generous in wanting to help us shift what was not working for them. So their generosity, their grace, their talent, and their support of DCBS was heartwarming. And then for my staff, who is challenged every day to just do what they have in front of them, for them to actually engage in a true visionary process for what they want to see our agency become, is what keeps me going during this very difficult time. So that was my biggest surprise on both from frontline staff, leadership, inside, and from our partners and trusted advisors, our existing clients that were there.
So Lesa, you've spent a career, knowing you started in the 8th grade, you've spent quite a few years looking at DCBS through its many iterations. What about you? At the end of the strategic planning process and you looked at that input, you're like, I thought I knew this, but I sure didn't expect X. What was the X factor for you?
It really, needed. So I know we've always had great participation from our partners and others, and when we've done things like this in the past, but there was such intentionness, I guess, intentional thought in each piece of the strategic planning that was really different. I mean, we talked about use of language, I think, was very different for me than what it has been in the past. So we were very thoughtful and very intentional at looking at what each word meant when developing that plan. And there's a lot of care, and having those individuals with lived experience at the table challenged us and pushed us on, we had a great statement drafted, but then hearing from them what those words meant, and to them as a person with lived experience, was so very powerful, and something that I have in my 24 years with DCBS have never experienced before, and was very thankful and appreciative that they brought that to us and helped us see through their lens what language meant.
Okay, great. So I'm going to ask a yin and yang question. Most of you know, but perhaps you don't, that before she was commissioner, Marta was a nonprofit leader, and before she was a nonprofit leader, she was an academic. Now, I have to tell you, Professor Marta Miranda-Straub. I bet that was a show. Okay, I would have loved to have been in your class. But I think that what doesn't get talked about, or maybe it's just that I don't hear it, Marta, is part of workforce prep and part of workforce reform is what's the labor force coming in. If you got anointed czar or czarina of preparation for frontline social workers, and you look at the changed context of the 21st century, what are your reflections on what our schools of social work need to be doing with those emerging professionals? So before they ever get hired at DCBS, what do you wish the preparation focused on that maybe it's not focusing on right now?
Thank you, Terry. One of the biggest pieces of my work at EKU was being one of the founders of the Public Child Welfare Certification Program. So we designed a way that universities across the state, in partnership with the state, would create a 2-year program to prepare folks who are coming out of social work to come work for DCBS. What the result of that 25 years later is that those are the ones, 80% of those, and the partnership is that we would train them. They will go through all the preparation that anybody coming into DCBS would have, but we will give them the specific skills that they needed. They will do their internships at DCBS. The outcome of that, we taught them conflict resolution. We taught them ethics. In depth as to how to apply with working with traumatized and poor people. That staff, many of which were my students, and remind me every day when I sit in meetings that they still have a VHS tape of me teaching them because I taught practice. Many of them, 80% of them stay past the 2-year commitment that they have to make to the state because the state pays for 2 years of their college program in order to then come work for the state for 2 years. That model is what I would love to see replicated. So that if folks who are interested in working in child welfare, working in DCBS, can have a 2-year training, 2 years specifically guided as to how to really work with the clients and the systems within DCBS. Not only are we able to retain those employees, 80% of them are here when the rest of the folks are not, as a result of having been to the PCWCP program. So what I would do is ensure that there be a 2-year pre-training for anybody coming in to work with us, in that there will be a very specific set of skill set and competencies, which we're adding to the DCBS certification, that are specific to the cabinet, that are specific to DCBS, and that our clients need us to have the minute we hit the floor running, not 3 or 4 years after that. So my SAR magic one is replicate the public child welfare program, updated to where we are now, the pandemic, racial reckoning, all of those pieces, racial trauma as part of trauma, engage healing, all those pieces that we now know, prevention, and really have a 2-year training module that all universities will have in order to become the pipeline for the next level of staffing for social works. In addition to that, I really think we need to really invest in developing leadership of color. Both our profit and nonprofit sector do not have representation of leaders of color, and that is unacceptable. I happen to be the first Latina being appointed to this position. That's sad. I'm honored, but that doesn't make any sense, right? So being able to have leadership models that take into consideration equity and access of leaders of color, so that we can actually diversify our leadership and diversify our workforce. So those are the 2 primary things that I would ask the universities to consider doing in order to really provide the infrastructure that DCBS needs to have a robust work and diverse and inclusive workforce. We need that, and we need you to do that, universities. And I'm really glad to help because I have a lot of ideas And we did an incredible job with the public child welfare program 25 years ago. And we're still receiving the benefits of that.
Yeah. So Lesa, what I'm curious about is one of the things that the Secretary, Marta, clients, partners all talk about is you really get the guts of how DCBS works. That's maybe inelegant, but you understand the operation. So translate, part of what I've heard, and we frankly talked about this for a long time, is differentiating staff at a regional office, the idea that everybody doesn't have the same job. There's career ladders. Marta referenced more senior complex case advisors. Can you, and I realize this is still theoretical, but could you take us ahead that if you could push a button, what would that regional DCBS office look like? What would the roles be? What would the functions be? How would that look different tomorrow than it does today?
Oh, a magic wand. So, we've talked a lot about our focus on prevention and moving more upstream. So there would be so looking at our right now as because of our staffing limitations, our workers are responding to everything. So those lower risk cases, high risk cases, very complex cases are being assigned to the same group of staff. So what I would love and what we're planning for and what we're working towards is a way to differentiate those caseloads and an alternative response model. So those lower risk cases are assigned to workers who have less experience, and then those more high risk and complex cases are assigned to staff who have additional training and supports and experience to manage in those cases. And their caseloads would be smaller because, again, those cases would require more time, more skill, more expertise. So, right now it's a mixture. Everyone's managing a little bit of everything based on their training. There are some cases that they're unable to handle because of training and things of that nature. But low risk, high risk cases are a part of everyone's ongoing workload. So if I could do anything, I would love to get us there quicker as to that opportunity for the alternative response model and looking at differentiating our caseloads, and then also being able to develop the skill set of our staff and by rotating them and cross-training them. So those staff that are newer and carrying less complex cases get to shadow and work with the more experienced staff and again, grow and develop our workforce and rotate staff in and out of those cases in which, again, right now, we don't have an opportunity to rotate staff until, you've been working on our specialized investigative team for the last, 6 months. We need for you to take a step back and, work over here so you can get away from that, some of that secondary trauma that you're experiencing and from those types of cases. So we don't have a system that we can help rotate staff in and out of and again, manage our caseloads in a way that enables staff to grow, and enables us to and again, to manage caseloads in a more appropriate manner.
Great. So I want to frame for all of our participants just a couple things, and then Marta, I'm going to ask you a final question, which is really, I'm going to invite you to benedict this session. So you can be thinking of a 60-second food for thought at the end. But we've got a particularly rich string of chat questions and comments, everything from what the heck is the book Upstream about, to what's the role of foster parents, to what are the specifics of KTAP reform, to what does the division of prevention look like, and everything in between. So what I want to share with folks on the call is we will get those questions answered, either Q&A and try to send those out before next week, or we'll address those. We've just got so many, and they're all really good, solid questions. So we want to honor those in a thoughtful way instead of doing a 30-second answer. Again, next week, we're going to have partners who react to this and those questions. And the other thing I'm going to tell you is my final question next week. So I already know the final question, which is I'm going to ask the commissioner that when you all bump into your state senator or your representative at church or the grocery in 2 weeks, what is the big question or the big message that you need to be sharing with those elected leaders going into 2022? Because this is an advocate partner forum. So we're wanting you not just to listen, but to be able to advocate. So I just want to frame that. So if you've asked one of those great questions, don't think that I didn't see it. I just want to be able to do that in a more thoughtful, respectful way than just a quick answer. So Commissioner, take just a minute and kind of send us out before I kick it to Courtney Downs and give us sort of your final food for thought. What do you want people to chew on from today until next Wednesday at 10 o'clock when part 2 of the DCBS show, the curtain lifts on part 2. So give us some food for thought as we leave.
Thank you. And I've tried my best to answer some of your questions. We'll be glad to, I put my email on there as well, and we'll be glad to respond in thoughtful. But I was able to answer some. So thank you, Terry, for capturing that, and we'll be glad to do that next week, tomorrow, however you want to do that. So my final thought that I want you to think about is, what does a real partnership with DCBS looks like? What does it mean to not see DCBS as an agent of the state, but as a public servants along with you to make sure that we jointly advocate for the Commonwealth and those of us who need us all the most. So how do we do that together? It doesn't mean not have the tough conversations. It doesn't mean not challenge or hold us accountable, but do what our trusted advisors should do, is tell us the truth, but walk with us as we try to fix this amazing organization that has the resources and the high impact of helping people when they need it the most, first. And secondly, remind your legislature of the impact that our staff has, the charge that they have to protect and support families and children, and that without having the capacity and the pay that they deserve, we are not going to be able to meet that mandate. We are at a crucial time where they need to appropriate funds for us to be able to build capacity and pay staff what they deserve to make. If not, we're going to be here 25 years from now again. And that is not a good use of your time or my time or the work that we've done so far. So help us get to the 21st century by being an advocate, being a spark plug with us, and continuing to be part of the solution, as opposed to the easy thing, which is to blame DCBS for everything that's wrong. That's not acceptable. So thank you.
Right, thank you. Okay, Courtney Downs, my good colleague at KYA, you're going to send us out, so take it away.
All right, thanks, Terry. And thank you so much to Secretary Friedlander, Commissioner Miranda-Straub, and then Deputy Commissioner Dennis as well for joining us today. We really appreciate your continued transparency about the challenges and also the opportunities with DCBS and just for all of the work that you all do as well. So we hope that everybody on the call will join us for part 2 of this forum next week, where we'll have a more in-depth conversation with the commissioner about the DCBS workforce, and we'll also hear from some community partners and other stakeholders and hopefully get to some of those questions that were left in the chat. On September 29th, we want to invite you to join us for the Bounce Grand Rounds, which is going to be happening at 10 o'clock until 11:30. As always, we thank Aetna Better Health of Kentucky for their continued support of today's Advocate Virtual Forum. We will send a recording of today's forum along with any slides and RSVP links for upcoming forums in that follow-up email. So thank you all for joining us and have a great day.